Hello, my name is Michelle Wynn. Today I will be demonstrating the IV fluid and medication skill. The supplies that I'll be using, I have 250 milliliters of normal saline. I have 100 milliliters of an antibiotic, which is amoxicillin. I have my gloves, I have my alcohol swab, I have my primary and secondary tubing. As you can see, they're both 15 drop factor. So the parts of the tubing. So we have the spike end. This is the end that will be spiked directly into the IV bag. So it's important to keep it covered until you're ready to use it. It should be sterile. You have your drip chamber. This prevents any air from going into the tubing, and it also allows you to visualize the flow rate. You have your roller clamp. This clamp will help you regulate the flow rate when it's in the down position. It's closed and not allowing anything to flow in or out. You have your Y port. This port, it can be used to put medicine in or to connect it to a secondary line. And then you have your adapter end. This is the end that will be connected to the patient's peripheral IV site. The secondary tubing is very similar. You have your spike end, you have your drip chamber, you have your roller clamp, and you have your adapter end. This adapter end will be connected to the Y port of the primary line. Okay, so to begin the skill, you would verify the physician orders. You will make sure that their order makes sense based on the patient's diagnosis. You would verify your 6 rights of medication administration, which is the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. For today's order, um, the doctor has ordered 150 milliliters of fluid to over 60 minutes at a 15 drop factor. So that's going to be 37.5. We're going to round it up to 38 drops per minute. For the medication, it's going to be 150 milliliters over, it's going to be 100 milliliters over 15 minutes at a 15 drop factor. So that equates to 100 drops per minute. Okay, so you will gather your supplies. You will proceed to your patient's room. You will knock before entering, close the door behind you for patient privacy. You will introduce yourself to the patient. You'll perform hand hygiene. You'll put on gloves, and you will have the patient verbalize their first and last name, their date of birth. You will verify that information with their wristband. Then you will explain to the patient why you're there. You'll give them expectations of what to expect from the treatment. You'll see if they have any questions. You'll answer any questions that they may have. You will confirm that they do not have any allergies. Even though they verbalize that they don't, you will also want to make sure that you are double checking their chart to make sure that there's no allergies documented in their chart. Okay, so we are going to begin with the normal saline. We are going to use the primary line for this. On the saline, there's 2 ports. This one, if we wanted to, we could put medicine directly into the bag, but we're not. So we're going to remove this, and then we will remove the spike in top, and we'll put it in. Okay. And then we want to get some liquid in the chamber. And now we are going to connect this. Okay, so as you see, I have placed it a little lower, and you'll do that when you are, since I know I am going to administer medication, I'm going to place the medicine a little higher than the fluid. And this is, you have to place it at least 30 inches above the patient's peripheral IV site. Okay. So you will prime the line to get any air bubbles out of the line. Okay, and then you'll be connecting this adapter in to the patient's peripheral IV site. So we don't have a patient, but if we did have a patient, we would check the patient's peripheral IV site to ensure that there's no redness, no swelling, no irritation, and just make sure that it's patent to flush. We would use an alcohol wipe to clean the area, and then we would connect this adapter into their peripheral IV. But for the purposes of this video, I have a trash can, and I'll place the adapter in the trash can. Okay, and if you recall, the drop factor for the IV fluid is 38 drops per minute. So it's important that we time this, and then we will count the drops. Okay, and I'm going to use the the roller clamp to regulate the flow. Okay. Okay, so I did verify that there were 38 drops for that 1 minute. Next, we will get the antibiotic ready. So when getting a bag, you always want to make sure that it's not cloudy. You want to check the expiration date. You want to make sure that the patient information is correct. Um, and then it's important, I would do the 6 rites of medication administration again. I will also double confirm that the patient does not have any allergies to this medication. Okay, so I am going to remove this top, remove the top to the spike in. Okay. And I'm just going to put some drops in here. And again, I am making sure that this is 30 inches above my patient. And it's also above the IV fluid. So we want to flush the line to get any air bubbles out. And then this is going to be connected to the Y port. So it's important to use your alcohol wipe to clean the Y port. You want to clean it and you want to allow time for it to dry. And then we'll connect the two. Okay, now as you recall, for the amoxicillin, it's going to be 100 drops per minute. So again, we're going to time this. Okay. Okay, so once that has been done, again, you would check in with your patient, make sure that they're okay. You would assess their site again, and you want to also just monitor them. Since amoxicillin is a highly reactive medication, you just want to make sure that they don't have any sensitivity to it. Um, and then you want to clean up your mess, discard of anything. You'll take off your gloves, you'll discard them, you'll perform hand hygiene, you'll check with your patient to make sure that they don't need anything, you'll place the call light near them, make sure that they're in a comfortable position, and then you will leave to document the procedure.